Hi, my name is Dr. Lindsay Ruland from Emergency Veterinary Hospital, and these are some of the top reasons why animals come into the emergency clinic. The single most common reason why animals come into our clinic is vomiting. Animals can vomit for a variety of reasons. It's hard to tell without examining the patient and without knowing their history and getting a little more information about whether it's sudden onset or been going on for a while, but it is by far one of the most common reasons that pets come in here. So when animals present for vomiting, we triage them, get their vital signs. Usually we'll get an initial set of diagnostics with x-rays typically, talk to the client, get more of a thorough history to understand if we need to do some blood work, because our goal is to really narrow the list of possibilities of why an animal vomits, try and narrow it down so we can get closer to a diagnosis. If your dog at home is vomiting what looks like white foam, and repeatedly trying to vomit something up, don't call, just come. Just get in the car and get here. That is very much a critical emergency there. Our biggest concern there would be for bloat. If your cat is a chronic vomiter, leaves you a little presence on your floor all the time, and now it's increased in frequency, or they're acting really lethargic, not able to hold any food or water down, then you should come in here. If your dog has eaten something recently and you know that they've ingested maybe a corn cob a couple of weeks ago, or there's a shoe that part is missing and now they're vomiting, you should bring them in. Definitely the cats who are the chronic vomiters and they just leave you little presents here or there in the morning. If they vomit once but they're still eating, I would just monitor them. Same thing for a dog. If a dog vomits one time, they're still energetic, they're still eating and able to keep food down otherwise, I would just go ahead and monitor them at home. Certainly if it progresses and it gets more persistent, then they should be evaluated. Another common reason that animals present here is male cats present with difficulty urinating. I would say that's right up there as one of our most common presentations. Frequently we will get a call for a male cat at home that is acting constipated. The owners will describe that they're in and out of the litter box and they're concerned that they might not be able to defecate. But if it's a male cat, our primary concern is that they can't urinate. So based on their anatomy, male cats tend to get urinary obstructions. It's a very common thing. If they get a urinary tract infection or any inflammation, sometimes they can have crystals or stones, those kinds of things, and they'll develop a urinary obstruction pretty quickly. The signs are in and out of the litter box. You may not notice them straining to urinate because most people will think that they're straining to defecate and think they're constipated. But when they cannot urinate, it is absolutely a life-threatening emergency. The urine backs up into the kidneys and puts them in kidney failure pretty quickly. They can actually progress within about 8 hours. So that is a significant emergency. If your male cat is doing that, you need to get him evaluated urgently. So we see several of those here at Emergency Veterinary Hospital, pretty much daily. Some cats we can treat with a urinary catheter in place and give them IV fluids and treat the kidney failure here with that. Some cats may progress to actually needing surgical intervention, which we do here. We're one of the only places in the county that'll do the procedure.
Hi, I'm Alex Brown and I am the Senior Veterinarian and Senior Medical Director here at Emergency Veterinary Hospital. So one of the most common reasons that we will see animals here in the ER is they've eaten something that they shouldn't. Sometimes that is some type of toxic substance, whether that's a medication or a pesticide or some type of insecticide. Sometimes that is some type of toy material, something out of the garbage, lots of things that pets like to eat that they shouldn't. Based on what they've eaten, it kind of depends on what we do about it. If it's some type of toy material, depends on how long ago they ate it. Same with any type of toxic material. Really, timing is one thing that's important. As far as when did they ingest the substance and what is it also is something else too. Depending on what they've eaten really kind of depends on the timeline of how quickly we need to act or do something about it. So anytime, I always recommend anytime a pet eats something that they shouldn't, something that is not a typical food or treat for them, really give your veterinarian or us a call. Really will depend on what we do about it and what we recommend as far as treatment goes. So anytime that something just seems off, not a bad time to reach out. Things that I would say my animals started doing X, Y, or Z, where you just get in the car and head here right away, would be collapse. So if your animal is acting normal, all of a sudden collapses. That is something that get in the car and just head this way. If they start breathing abnormally, for a cat, that means they look like they're panting like a dog. That's extremely abnormal. So just get in the car, head this way. If your dog is having like really deep breathing, acting like they're gasping for air, that's another time. Get in the car, just head this way for sure. So chocolate is a substance that you or I love to enjoy, but unfortunately for a lot of our pet species, it can be very toxic. So it does depend on the type of chocolate and how much has been eaten and also the size of the pet. But chocolate is toxic to most of our pets, unfortunately. Dogs, cats, birds, rabbits, and I've seen all of those species ingest chocolate, unfortunately. So again, chocolate ingestion is one of those things where we typically don't see signs right away after ingestion, unless it's a really large amount. Sometimes they'll puke right after they've eaten the chocolate. But if they have ingested chocolate, give us a call. We'll likely ask you the pet species, their weight, what type of chocolate as far as milk chocolate versus dark chocolate, and then how much did they ingest as well, to do a calculation to see if it's something we need to be worried about. The higher the cocoa content in the chocolate is more of the concern than the actual chocolate itself. So dark chocolate, or you see those big fancy chocolate bars that say 70% cacao on them, that's when we're worried, more worried than just your standard Hershey Kiss milk chocolate type of a situation. So another reason we'll see animals a lot of times is changes in their breathing pattern. That's something that, again, is an emergency, and we don't recommend waiting whenever there's a breathing change, and no matter what the species is. Biggest thing that can, the type of breathing pattern depends on the species itself. So for instance, if a dog is panting after they just went for a run, well, that's expected and nothing that we worry about. But if a cat is panting after a run, that is something we worry about. So anytime we see a cat panting, especially after exertion, is normal. So if it's after exertion, it's nothing that we really worry about. Now, if it's, middle of winter, cool, and they're panting, that could be something that could be of concern. Sometimes it's something just like anxiety or pain sometimes can cause panting in a dog. But really the things we worry about in dogs is really what we call labored breathing. So really deep breaths or really exacerbated breaths. So like kind of breathing versus just your typical happy-go-lucky panting dog. So any wound that penetrates through the skin layer can warrant a veterinary visit. We definitely want to make sure that the sooner we're getting to those wounds, as far as getting them cleaned, assessed, cleaned, and then antibiotics on board pending the wound type, the sooner the better, realistically. The concern with any type of wound, if we leave it untreated, is that there's usually bacteria that gets kind of inserted under the skin, and then that can lead to further infection, further larger wounds than what was initially there, and it can just take a lot longer for it to heal. One of the last reasons we'll see patients in the veterinary ER are wounds or injuries of really any type. So common wounds that we'll see will be dog bite injuries, so animals getting in fights, even cats, cat on cat bites as well. You've got animals that will run around either at home or in the woods, get cut on sticks or potentially sharp metal fragments that maybe I've seen dogs get cuts on like parts of trailers and that kind of thing. Other wounds, obviously animals that get hit by cars, Those more intense trauma patients we'll see a lot of, but lots of sources of wounds, unfortunately. So wounds that aren't that big of an emergency are going to be ones that don't penetrate all the way through the skin. So if you think of like your typical, well, I fell down and I skinned my knee type of a wound, so very superficial type of an injury, typically those don't need much emergency care realistically. You know, just typical kind of general first aid at home as far as cleaning that wound is typically all those animals will need. Now, sometimes that can be hard to do at home, and we're always happy to help just kind of clean up your superficial wound, little skin wound type thing, but usually they don't need a ton of emergency care realistically.